After 40, something subtle begins to change. It doesn't happen overnight. You don't wake up one morning unable to stand. Instead, it starts quietly. You might notice you feel slightly unsteady when getting up too quickly. Maybe you grab the railing more often on stairs. Maybe you avoid uneven ground without realizing it. This isn't weakness. It's not laziness. It's biology. Balance is not just about your legs. It is a system, a coordination between your inner ear, your eyes, your nervous system, and your muscles. When you are young, these systems communicate instantly. Your brain receives signals from your feet, from your vision, from your vestibular system inside the ear. It makes micro adjustments in milliseconds. You don't feel it. But after 40, that communication begins to slow down. The inner ear becomes slightly less sensitive. Neurotransmission speed declines. Muscle response time becomes slower. None of this is dramatic, but together it creates instability. And here's the real problem. Balance is use it or lose it. When we were younger, balance was trained automatically. We ran, we jumped, we climbed, we moved unpredictably. But adulthood becomes predictable. We sit more. We walk on flat floors. We avoid risk. Our environment becomes stable. So our body stops practicing stability. The brain starts to downgrade balance processing because it's not being challenged. This is why falls increase dramatically after midlife. Not because people suddenly become fragile, but because the balance system hasn't been trained in decades. And here is something most people misunderstand. Strength alone does not equal balance. You can lift weights and still have poor balance, because balance depends on small stabilizer muscles, especially around the ankles, hips, and core, and on neural timing. These tiny muscles are rarely trained intentionally. Another major factor is vision dependency. After 40, people rely more on vision to stabilize themselves. If the room is dark, they feel less secure. That's because proprioception, your body's internal sense of position, becomes weaker without training. Balance also affects confidence. When someone feels slightly unstable, even subconsciously, they reduce movement. They walk slower. They avoid certain activities. This leads to less stimulation, which leads to further decline. It becomes a quiet downward spiral. But the good news is this: balance can improve at any age. Unlike certain aging processes, balance is highly trainable because it is neurological. The brain can rewire. Reaction speed can improve. Stabilizers can strengthen. And the most powerful balance exercises are not complicated. They are simple, controlled, intentional. For example, standing on one leg for 30 seconds. At first it feels easy. Then close your eyes. Suddenly, the brain has to work much harder. This stimulates the vestibular system. It forces communication between sensory systems. Walking heel to toe in a straight line is another. It challenges coordination. It activates ankle stabilizers. It teaches the brain precision, slow lateral movements, stepping side to side, retrain hip stability, which is critical for preventing falls. Balance training is not about intensity. It is about consistency. 2 to 3 minutes per day can reawaken neural pathways that have been dormant for years. And there's another overlooked factor: inflammation and nerve health. Chronic low-grade inflammation can affect nerve conduction and joint stability, which means balance is not only mechanical, it is metabolic. Hydration also matters. Even mild dehydration can affect equilibrium because the inner ear relies on fluid balance. Sleep matters. Reaction time declines sharply when sleep is poor, so balance is not isolated. It reflects overall health. And here is something interesting. Studies show that single-leg standing time predicts longevity. People who cannot stand on one leg for 10 seconds have higher mortality risk, not because balance causes death, but because balance reflects systemic resilience. Your ability to stabilize yourself is a window into your nervous system health. In midlife, protecting balance means protecting independence, because balance lost doesn't just mean falling. It means losing confidence to move freely, and movement is life. Let's talk about how to rebuild and protect balance after 40 in a sustainable way. First, stop thinking of balance as an exercise category. Think of it as a daily skill. The simplest way to train balance is to integrate it into routine tasks. Stand on one leg while brushing your teeth. Switch legs halfway. That alone, done daily, creates neurological adaptation. When waiting in line, shift weight slowly from one foot to the other. Controlled, intentional. Walk on slightly uneven surfaces, grass, sand, trails when safe. These environments force microadjustments. Second, strengthen the hips and ankles. Most balance instability begins at the ankle. Weak ankle stabilizers delay reaction time. Simple calf raises, slow and controlled, rebuild this foundation. For hips, lateral band walks or slow side steps improve pelvic control. The hips are your body's steering wheel. When they are weak, the body sways. Third, slow down movements occasionally. Fast movements hide instability. Slow movements expose it. Practice slow squats, slow step downs, slow directional changes. Slowness builds control. Fourth, challenge visual dependence. Practice balance in low-light conditions safely. Close your eyes during simple exercises for a few seconds. This strengthens non-visual sensory pathways. Fifth, improve posture. Forward head posture shifts your center of gravity. That small shift increases fall risk. Alignment is balance. Sixth, reduce chronic inflammation. Whole foods, regular walking, adequate protein, omega-3 fats, stable blood sugar, all support nerve health. Seventh, keep moving daily. Sedentary behavior dulls neural responsiveness. Even light daily walking maintains reflex pathways. Balance decline is not inevitable. Severe decline is not automatic. It accelerates only when ignored. Midlife is the perfect time to intervene. The goal is not athletic balance. It is stable, confident mobility for decades. Imagine being 70 and stepping off a curb without hesitation, walking on a rocky path without fear, turning quickly without dizziness. That begins at 40. You do not need complex programs. You need awareness. Balance is quiet. It is invisible. Until it isn't, train it before you feel you need it. Because longevity is not just about living longer. It is about staying upright. And the ability to stabilize yourself physically and neurologically may be one of the most underrated health markers of all.